We are reporting for 3 periods today. From Friday to Saturday, we had 698 new cases of COVID-19 reported in British Columbia. From Saturday to Sunday, an additional 689 cases were diagnosed, and from Sunday to today, 759, bringing our total to 2,146 new cases since our last report on Friday, including 16 epidemiologically linked cases. That brings our total number of people diagnosed with COVID-19 in British Columbia to 42,943. Of the new cases, in the last 3 days, 300 were people in Vancouver Coastal Health Region, 1,474 people were in the Fraser Health Region, 29 people were in Vancouver Island Health Region, 250 people in the Interior Health Region, and 91 people in the Northern Health Region. In addition, there were 2 new cases diagnosed in people who live outside of Canada. We now have 10,039 active cases across the province, of whom 359 people are in hospital, 87 of whom are in critical care or ICU. We have 11,177 people who are under active public health monitoring, again, in every health authority in the province, and 31,207 people who are now recovered from COVID-19. Sadly, again, this weekend, we've had far too many people die from COVID-19. We've had 49 new deaths, bringing the total number of people who've died from COVID-19 to 647 in British Columbia. The number of people who have died and the number of families and care providers who have lost loved ones as part of their community over this weekend is a tragedy that all of us feel. My condolences go out to the families, the care providers, and the communities. We know that this is a most challenging and difficult time, and we mourn with you and feel your loss. We have 3 new healthcare outbreaks in the Jubilee Lodge, the Fraserview Intermediate Care Lodge, and Villa Caratal, and 6 outbreaks have been declared over in the past weekend. One of them at the Felburn Care Centre in the pathology unit. Unfortunately, there still remains an outbreak ongoing in the long-term care area. In Fleetwood Villa, the Residence Mission, the Swayas Rainbow Gardens, the Windermere Care Centre, the second outbreak there, and the West Coast General Hospital are all over, leaving us with 55 active outbreaks in long-term care and assisted living and 7 in acute care, involving 1,305 residents and 726 staff. Today, as people will have heard, the first doses of a COVID vaccine manufactured by Pfizer and BioNTech arrived here in British Columbia, sort of late last night. And teams now are doing their final preparations to start our first immunizations in our clinics tomorrow. What this means is that we now have a safe and effective vaccine that has been approved for use here in Canada and is available here in British Columbia. And this is momentous news and the first step in our path to protecting people most at risk in our communities and taking the pressure off our healthcare system so that care is available for all of us who need it across the province. This week, the first vaccines will be given at 2 sites here in the Lower Mainland, one in Vancouver and one in the Fraser Health Region. And next week, with the supply that we expect to receive, vaccine will be available in every health authority across the province. I can't tell you how exciting this is to know that this start of this new phase of being able to protect people is beginning here in BC and in Canada. As we know, the global pandemic has meant a year like no other for all of us. And we are all doing things that we have never done before. And we know as we're heading into or in the midst of this holiday celebrations that we have to remember every time we are together, there is risk. There is risk in our communities across the province right now and across the country and around the globe. No event or gathering is completely safe right now, and we need to be aware of that because the virus continues to circulate in our communities, and tragically, people continue to lose their loved ones to this virus. You may be doing all you can to protect your family, your loved ones, and yourself, and I know most people here are doing that, and it is making a difference. And that's what we all need to think about right now. It doesn't take away, however, from the potential that someone you spend time with may inadvertently bring the virus with them to your house, to your dinner table. Our homes don't have those many layers of protection that we find in other places. We spend more time close together. We aren't using masks for the most part. We don't have those barriers and those safe distances that we have in place in workplaces and other public settings. A few minutes at the grocery store or shopping in your local retail store is quite different than sitting with your extended family or with friends or loved ones that you have not seen for a while in your living room for the afternoon or for the evening or longer. If you're wondering about how to safely have those important family and friends and close connections, whatever your family is, there are many ways that you can do that in the coming weeks and make those occasions new and special. I've heard of many creative ideas, and people have been sending me some of the things that they are planning on doing or have been doing over these last few weeks. I wanted to share a few today. Some of these are like a contactless doorway drop-off of cookies or stocking stuffers or a ready-made breakfast on Christmas Eve or Christmas Day or on a special morning for you. I know some that are having Zoom holiday dinners on big screen TVs and celebrating that way. Others have gone one step further and are having the same meal with the same table decorations in each of their homes, and finding ways to cook together or to share that important communal food in a way that is safe for all of the members of their family. Some are still cooking for a large group, but doing meal delivery for their family members or friends or neighbors instead of having people over. Others are sharing holiday playlists in advance and planning for a post-meal Zoom karaoke competition, which I know nobody will invite me to who knows me. What I know about, without a doubt, is these important connections can still happen at a distance and safely. And we may create new traditions, new ways of doing things along the way. And it will ensure that those we are closest to and those we love and those who are at risk will be there to celebrate with us next year. As more people are protected with our COVID vaccine and the number of cases we hope will decline, we will be able to safely resume those activities that are paused right now for these coming weeks. As I said last week, there will be a time when we will be able to take our masks off, when we can see and hug our loved ones, our friends, when we can travel to see those others that we care about. But we are not yet there. There are no safe gatherings right now, and we have to be cautious. We have to be cautious because we are so close, but we cannot let up now. So many have done so much, and I think of all of our workers in long-term care who are tired, who've been working long hours, our frontline social sector workers, caring for those with disabilities, people who are living in our shelters, in our homeless populations, healthcare workers who are working in our COVID wards, our ICU wards, which are right now filling up, and providing care from the community to hospitals. These are what we need to think about now. We need to continue to do our part to bring our community rates down, to take that pressure off, and especially for those we know who are most at risk, to protect our elders and our seniors. This is especially important when we're at this point now where we have vaccine, and soon we'll have more widespread vaccine availability. This holiday season, let's make these special occasions special in other ways by connecting with each other and supporting each other and caring for each other virtually instead. Let's save our celebrations in person with those we care about until it's safe for us all to be together again. And let's also remember to be kind, to be calm, and to be safe.